Most people don't want to go to the ER under any circumstance. It costs a fortune. You got to wait for 8 to 10 hours sometimes. So what is your other choice? But there's no middle ground, is there? But guess what? The hospital loves it because the hospital gets to bill more.
And here's another one, the ninja doc, Noah Kaufman.
Dr. Noah Kaufman is here. He's an emergency room doctor.
Hi, I'm Dr. Noah Kaufman. I'm a 20-year board-certified emergency room physician, and I'm the founder of KaufCare Advanced Urgent Care here in Denver, Colorado. One of the most frustrating things being a patient and going to urgent care is paying your copay and then realizing that you're being sent to the emergency department anyway. I see this all the time as an ER doc, and it's super frustrating. I see something that we can definitely take care of outside of the emergency department because 90% of the stuff that comes to the emergency department can be cared for outside anyway. So when you go to an urgent care, someone might not be able to take care of you. And that's really frustrating, especially if you've already paid their copay. Getting sent to the emergency department is one of the worst things because you have to wait 6, 7, 8 hours. You might be in pain, you might be nauseated. The emergency department is really good care. I know because my colleagues are fantastic and they've been trained and they're board certified. So you're going to get really good care when you're at the ER. But you also are having other patients with heart attacks and strokes and maybe gunshots or stab wounds. So maybe your infected toenail is going to sit in the waiting room for a long time. So what is your other choice? Well, you can go to your primary care doctor, but they might not be able to handle your problem. You could go to urgent care. That's the other solution. But urgent cares are set up with mid-level providers who might be very, very good, but are generally trained to deal with fairly easy problems that don't take a lot of medical decision-making. Sewing up small cuts and dealing with small infections, that sort of thing. But there's no middle ground, is there? Until now. Now there's KaufCare, Advanced Urgent Care in Denver. And we are that sweet spot between the emergency department and the urgent care. I'm a 23-year board-certified emergency room physician, so I can take care of almost everything that is not life or limb threatening because then you should go to the emergency department. But everything else, if you would go to the ER and you're not about to die, you can probably come to KaufCare. If your shoulder's dislocated, I can fix that for you. If you have a fractured wrist and your arm is facing the wrong way, I can fix that for you and put you in a splint and get you to orthopedics see if you need surgery. We can cut open abscesses. We can do all sorts of procedures that they would never, ever touch at the urgent care. And I know because the urgent cares have been sending me those patients in the emergency department for 23 years. So I decided to come out into the neighborhood, open up an advanced urgent care that was really top of the line and focused on quality and compassion. And that's why I founded KaufCare. They are high volume, low acuity centers, like a factory to get people through. And they have a very, basic sort of revenue system, but they're being optimized not to take care of people, but to get volume. They're being optimized to treat people. The more people come through the urgent care, the more money they make. And that's the bottom line. So, urgent cares are all about getting more and more people through the urgent cares. And if there's something they can't deal with, that's fine. But if you're a business like an urgent care and you're trying to make the most money possible, well, doctors are kind of expensive. Like our hourly rate for the training we've done, it's like a lawyer or another professional. It's kind of a higher rate. So what are you going to do if you're one of these companies trying to improve the bottom line and just make as much money as possible? Well, you're going to get mid-level providers. You're going to get mid-level providers, and there's all kinds of arguments about, well, this is access to care, and we can, deliver care effectively and efficiently with APPs. And look, I'm not saying APPs aren't great providers. There are some APPs who I think, frankly, are better than some doctors I know. And there are some APPs who are just incredible, and I would let them work on my family as well. When an urgent care turns away a patient with a deep cut or suspected broken bone, what's actually happening behind the curtain regarding their business model? Well, believe it or not, an urgent care is set up to see as much volume as possible, but safely. I mean, obviously, we have to practice within our specialty, within our scope of practice, and within our abilities. Now, if you're a PA or an NP, or a mid-level provider, often called an APP, you have a lot less training and experience than most physicians, especially a seasoned physician with 2 decades under their belt in the emergency department. So, if you encounter something that you are not quite ready to deal with, or maybe a laceration that's a little bit too big, or a broken bone, or a dislocated finger, or another joint, that might be something that you're going to send out to the emergency room. And also, the pricing model for most urgent cares really only includes certain very basic things, basic medical care, such as a strep test or something else along those lines. And because of that, it's very easy to send things out to a higher level of care. And it's the appropriate thing to do. I'm not being critical of urgent cares for this in any way, shape, or form. But the problem is you don't really know what you're going to get in the urgent care. You might be getting an APP who's fresh out of school, maybe a couple years. And this is a good first job for them at the urgent care. And that's how most urgent cares are set up. They're set up for volume. They're set up to take care of lower risk, pretty easy medical care. And of course, they can do simple lacerations because that's well within their scope. They can do simple infections. They can do other simple things. But for anything really serious or more skill demanding, they're going to be sending those cases to the emergency department. And again, that's good because otherwise they could find themselves in some medical legal problems. And that's why we created KaufCare. We really saw a huge need for quality, caring, compassionate care outside of the urgent care where it's all about volume and long lines and the bottom line, and outside of the emergency department, which is also long lines, 6 to 8 hour waits, and the highest level of care, but maybe you don't really need to be there, even if you're referred there from the urgent care. If standard of care is to first do no harm and to take care of people within your scope of practice, but we only have the choices of an urgent care, which is extremely low level and very basic stuff, or an emergency department, which is extremely high level and very complicated stuff and big long waits. What's in the middle? Well, nothing until now. And that's why we created KaufCare. KaufCare is ER doctors who are board certified and have practiced often for decades, coming out into the community and replacing urgent cares with something better, with higher quality care from a very experienced physician. Do all sorts of stuff, take care of fractures, do x-rays, do ultrasounds to rule out deep venous thrombosis or DVT, and then do IV fluids, do joint injections, do dislocations, do abscesses, pilonidal cysts, ingrown toenails, minor surgeries to remove foreign bodies in the eye. KaufCare is for everything that is not life or limb threatening. You're truly scared for your life. We will call 911 and get you to our colleagues at the emergency department who are incredible at taking care of trauma and stroke and heart attack and might need to do things like intubate you or protect your airway. We're not going to do that at KaufCare. We are an advanced urgent care that is transparent prices, and we sit smack dab in the middle of the ER and the urgent care. So if you want transparent prices, if you want to know what your bill is going to be that day and know what the prices are before you have anything done, and so you can make an informed decision, come to KaufCare. You can also check out our pricing online at kaufcare.com/pricing. And you can see all of our prices transparently posted online like a menu. And that way you know exactly what you're getting into. And you can also talk with an experienced physician and ask them, do I really need this? And the prices are often 70 to 90% off the emergency department, and frequently about the same as the urgent care anyway. But of course, the urgent care won't do a lot of the procedures we're doing at KaufCare. That's why we are called a direct acute care. a DAC. So you might have heard of DPC, which is direct primary care. KaufCare is a direct acute care, a DAC. And we're one of the first of our kind in the country. We're offering a new path, board certified emergency room physicians, to come out into the community and be a good neighbor. Well, I'll tell you, it looks beautiful. Patients really enjoy their care. They resonate with an actual connection. And in the ER, the docs only have 30 seconds or a minute. You're lucky if you get a doc who sits down and really takes time with you. And it's not their fault. Why do physicians and PAs who are working in the ER order every test in the book, every CT scan, every lab? The reason is because of medical malpractice problems in this country and defensive medicine. It's driving up the cost of care, and it's a real problem. So when you come into the emergency department, it's not okay if we miss an emergency. And we will get sued immediately if we miss an emergency. And liability makes it so that we have to order this stuff. But guess what? The hospital loves it. The hospital loves it when we order CT scans. The hospital loves it when we do all the tests and every test in the book. Why? Because the hospital gets to bill more. There's higher level of care, and we also are protected because we're not getting sued as much. If you do every test and they're all normal, then it's harder to sue somebody. Versus if you didn't do the MRI and you missed something bad, it's easier to say, well, why didn't you do it? And that's one of the real problems of modern medicine. And that's a problem across medicine. What helps with that? Well, being a really experienced physician, you can really, really order less tests. You really understand who's sick, who's not sick, what you need to do. We had 40 doctors in our group, and we kept track of how many CT scans every doctor ordered. I was the second to the bottom in terms of ordering CT scans. I mean, I ordered half as many as the people right in the middle, the average. But then there were people who ordered twice as many CT scans as the people in the middle. And so who do you think the hospital likes more? Well, the people who are ordering twice as many. But ironically, the people in our group who had had the most lawsuits, they were the ones ordering the most CTs. You know, we're practicing medicine here. And this kept this poor patient constantly looking and going to the next test and the next test and the next test. And if you keep having more and more tests, then you're constantly having that anxiety. And the system thrives off of that. I mean, think about how much money the system is making off of this crazy wild goose chase. But let's talk about clinical expertise. Let's talk about how over-testing isn't just a financial problem. It's actually bad medicine. You know, if you go looking for stuff with an MRI or every test in the book, you're bound to find something. And that something is going to lead to more tests and maybe more x-rays and more imaging. And 9 times out of 10, you're going to end up chasing your own tail. And it causes a lot of anxiety for the patient, and it ends up being nothing. Here's an example that I had the other day. Sometimes patients are worried that they have a disease or an illness, so much so that they convince themselves that that's what they have. Well, I had a patient who had convinced themselves that they had had a horrible medical problem for months and months and months, and they had seen 15 different doctors, the emergency department, they had CAT scans, they had MRIs, they had GI scopes, they had every test in the book. And when the patient finally got to me, there wasn't a lot to do because they were trying to, really prove that there was this disease that really there was no evidence for. And those are tough cases. And you can't dismiss those patients. Their problems are just as real as all of our other problems. There was rampant over-testing. And this kept this poor patient constantly looking and going to the next test and the next test and the next test. And if you keep having more and more tests, then you're constantly having that anxiety. I can tell you that we use probability, physical exams, and actual clinical experience to rule out dangerous conditions, oftentimes without even needing complex tests or labs or doing everything in the book. Medicine is probabilistic. We all look different on the outside and we all look different on the inside, and we respond differently to different drugs. Overall, I don't think that you're in any trouble. I'm not worried about you having a life or limb threatening problem. If I was, I would send you to the emergency department. But since we're not, this is how we can deal with it. We can treat your symptoms while we're trying to get a solution to what the diagnosis is. And these are what we're going to do to treat your symptoms. We can try this, this, or this, and we can see how it's working. And then while we're doing that, we're going to order a couple tests, not too many, but a couple tests to see if we can rule out the bad things and see if we can narrow it down so that maybe we can send you to a specialist if we need to. And so that's why we created KaufCare, to fill that gap between the urgent care and the emergency department. Thanks for joining. I'm Dr. Noah Kaufman, founder of KaufCare Advanced Urgent Care in Denver, and we would love to take care of you and give you the transparent prices and the compassionate care that you deserve.